Hi guys, Dr. Pam here. I'm a doctor in nurse practice, and if you need more of this information, PowerPoints and links, I'll share them in the video down there. So let's do the Peads, just Peads, developmental growth for Peads, real quick. So remember, before you go to do exam, know we have fontanelles. The posterior fontanelle, which closes faster, and anterior fontanelle, which closes later. The posterior by 6 months, the anterior by 2 years. If it closes too early, you have to refer these patients. They might have to do surgery because the brain is still growing. So that is the anterior one. Weight, you have to remember the baby, when she's born, the weight doubles at 6 months and triples by 1 year. That one you have to know. If a mom is breastfeeding and she's having mastitis, encourage the mom to continue breastfeeding. 2 months, the baby starts cooing. 4 months, the baby started smiling and realized they have hands, puts hands in the mouth. 6 months, the baby sits up but can tip over, can grasp into things. But they can 6 months they sit up and but can tip. 12 months the baby can walk, they can use a sippy cup. 2 years, very important guys, 2 years the baby can understand the family, but 3 years the baby can understand strangers, very important. 3 years the baby can also draw a circle and they can ride a tricycle. So 3 for tricycle and a circle. 4 years, the boy or the child can draw a cross for 4. So remember that. Let's see other things you have to remember in Peads. Sickle cell, when a child has a sickle cell, they are dehydrated. So I would prefer, if they come to your office, send them to the emergency room so they can be hydrated, and they can also be given pain medication because they can be in pain. Wilma tumor is usually for African American girls. It grows in the kidney. You can refer those patients out. GERD, for little kids, if they are experiencing GERD, sit them up straight up, so that after they finish eating, before you lay them down. It's very important. Intussusception, with so many S's, sausage-like mass, usually the intestine folds inside. So intussusception with sausage, don't forget that. And caprices, a child refuses to poop because they feel like they're losing control. What do? Give them stool softeners, but also you can refer these kids if they're having other issues. So if they have caprices, they are impacted with stool, you have to do something to relieve them. Undescended tests, please guys, once a child is 12 months and the tests are undescended, refer these people to urology, let them get some surgery, let them pull the tests back to the right place. It's very important because this is associated with cancer, okay? Testicular cancer, okay? Hydrocele versus varicelle. The varicelle is the one, when you put a stethoscope, it feels like worms, okay? And the hydrocele is the one that has illumination. It is fluid filled. Which other place, guys, do you, if you ask that question, I didn't know that until I read about it. Like when somebody has some sinuses and stuff like this, if you put the whatever illumination, you can actually see the fluid up here in the sinus. So it's not only down there, it's also in the sinus. Otitis media versus otitis externa. Otitis media, we give penicillin. Otitis externa, we give Cipro drops. Don't forget that. one more last few things. Colostrum, the milk that gets from the child a mother when she gives birth. Please make sure the mothers breastfeed and encourage them, because it has antibodies that are good for the child. Always remember, we don't give children milk until they are 1 year, 12 months. Okay? Meconium. Remember, meconium the child has to pass meconium within a few hours after being born. If they don't, it could be an obstruction, or they could be having cystic fibrosis. So that is very important. Solid food, we start from 4 to 6 months. We start one food at a time. We either start rice or start one food at a time. Why? Because we want to know if these kids have allergies. Okay. Caput sarcoidoneum, edema of the scalp. It crosses midline. Caput, like a cup, crosses C and C. Caput crosses midline. Remember that. The weight of the neonates goes up 7% body weight, and the baby loses the body weight, and in 2 weeks they regain their weight back. Okay, guys, the first original primary tooth occurs 6 to 10 months, but the permanent tooth or teeth occurs 6 years. Know the difference between that. When you are reading the question, please read and make sure, are they asking primary or permanent? Okay. There's this thing of the kid or having I don't know how to speak, hyperspodias, having the hole in a different location. It's on the ventricle aspect of it, and epispodias, it is having on the dorsal aspect of it. If you don't understand that, guys, go check it out. The hyperspodias and hyperspodias and epispodias. So check those two and know the difference, where the urethra medius is located. One is located up, hyper, and the other one is at the bottom. Know that before you go to do exam. Okay. Also remember, we said caput sarcoidoneum crosses midline, but hematoma does not cross the midline. Okay, guys, I think that's about it. Let me see if there's anything that I can share with you. At 4 months, the baby also rolls front to back and back to supine. Don't forget that. 4 months. At 2 months, they can coo, make gargling noise. What about 9 months? 9 months is when they have the pensagrasp, fine motor skills. There's also, like the kids when they are born, the tear ducts are not grown so well. That is called dacrocytosis. If they have acute dacrocytosis, inflammation of the racromoduct. What do? We massage it downwards. We massage that when the kids downwards, or we can give them antibiotic. Also, something you need to know, developmental dysplasia of the hip, how we do them. Go learn. I have good videos with PowerPoints. If you need them, you can. Between the developmental dysplasia of the hip, Otolani maneuver, and Boro, you need to know those. Otolani maneuver, you hold the knee in like a frog, and then I don't know how to do it, but you know how to do it. And then check for the developmental dysplasia of the hip. And borrow, you move the kid. Once you move the kid so that it moves to the back. Borrow for butt. Okay, that's the best I can explain, guys. What about neuroplastoma? Abdominal pain or mass from irregular fixed. It crosses the midline. It's on the adrenal medulla. So what do we do as nurse practitioners? We order for an ultrasound and refer these kids to neuroplastoma. There is also one thing, epiglottitis. Remember that? Anytime they talk about potato, they talk about potato, a kid hyperextended, they can't swallow. They're sitting, it feels like there's a potato in the mouth. That is epiglottitis. Refer those patients out immediately. I have more videos. If you like what I'm sharing, you can go and subscribe. Thank you. My name is Dr. Pam. I'm a doctor in nurse practice, DNP. I'm just sharing so that somebody can get this information and it can help them. Thank you. Be blessed.